Well, it looks like it's 12 o'clock, everyone. It looks like people are still joining in, so I'm just going to give it a couple more minutes just to make sure that everyone has a chance to join in that wants to. Okay, I'm going to go ahead and get started. Hopefully everyone can hear me okay. So welcome everyone to the state of Vermont's first virtual benefits fair. Typically we hold the benefit fairs during the flu shot clinics, but this year with the pandemic, that's not really a viable option. So instead we decided to make the benefits fair virtual, which in some ways hopefully means that we can reach even more employees because it's not tied into the clinics. Unfortunately, that does mean that we will not be able to pass out chapstick or potato chip bag clips like usual. So sorry that can't happen virtually. But today is the first day of today is the first day of the fair, and we are going to hold a presentation every day this week from 12 to 12:45 from each of our major benefit vendors. Today we're starting with Blue Cross Blue Shield of Vermont. The vendor will give, or so Blue Cross Blue Shield will be giving a presentation, and we will end with a question and answer session. Just a couple of quick housekeeping items. Please keep your mics muted at all times to avoid disruption. And if you have any questions, please send it through the chat function. And I will be moderating the chat, and I will ask the questions when appropriate. And hopefully we can get to everyone before we sign off, especially during the question and answer session. If we do run out of time, we're going to collect the questions and hopefully reach out to all of you with an answer as soon as possible. Please keep in mind that the presentations are being recorded for future viewings and are not confidential. So please make sure to keep any questions at the benefit level as opposed to making them about personal situations. I think that's about it. So I'm actually just going to pass the mic now over to Blue Cross Blue Shield and to Jess Pinkins, who's our account manager, and she'll run with it from there.
Thanks, Clark. Good afternoon, everyone. I know this year is definitely different than it has been in the past, and I'll certainly miss handing out the chapsticks and the clips, and the hand sanitizer last year was a big hit too. So, but I'm glad you're all here and we could meet virtually at least. So like Clark said, I'm just going to go through a quick presentation just about some of your benefits. And I also have Colleen Sanford on the phone, who's one of our nurse case managers, and she'll review the integrated health programs that we offer and just kind of give a reminder of the different programs that we have at Blue Cross Blue Shield of Vermont for all of our members. And then we'll open it up for questions. The first thing, and I won't spend too much time on this, but just kind of a quick look at your two different plan designs that you have, the Select Care and the Total Choice. I put this here just for a reminder. Nothing is changing this year, so the co-pays on the Select Care are remaining the same, and the deductible and the co-insurance and out-of-pocket on the Total Choice are remaining the same. So again, just a quick view of what the benefits are, but again, nothing is changing. I wanted to take a minute just to go over some COVID member cost sharing that we've adjusted due to the pandemic. And since it's kind of why we're here and doing this virtually, I thought I might take a minute to go over that. And many of you may know what we've done. We've done some stuff on the provider side as well. I'm just going to focus on the member impacts here. But what we've done for the COVID-19 impact, for any of the COVID tests that you've received at an office visit or at a facility, we're waiving all of the cost share. So no co-pays, no deductibles, no co-insurances for any of those tests and treatment that come through with that COVID-19 diagnosis. One thing to note about the tests, and I know that you as a state are probably familiar, you've had those pop-up testing sites, and we don't get those claims. You don't have to pay out of pocket for those, but those claims are not billed to Blue Cross, so we actually don't see those. But anything else, if you go to a facility for urgent care and get tested, any of those claims were processed with no member cost share. The other thing that we did was waive member cost share for Amwell. So Amwell is our urgent care telemedicine vendor. And on the next slide, I'll show you what kind of services they offer. And we're waiving member cost share for any urgent care telemedicine visits as well. You'll see down below on the second half of the screen that we've expanded our telemedicine and telephone coverage as well. So not only are we waiving the cost share, but we've expanded our services so that members don't have to go into the office. And we've seen a huge
I'm sorry, but I'm having a hard time hearing you with all that background noise.
Okay, hang on just 1 second. I thought everyone was on mute, but let me just give me 1 second to double check. Okay, everyone should be on mute now, so if you need to talk, you'll just need to take yourself off mute. There's a little microphone there, but no one should have to until we get to the question part, so we should be good.
Thank you. Thank you.
Yes, no problem. Thank you. So the expanded telemedicine and telephone coverage, you'll see here that we've expanded access to these services so you don't have to leave the house and go into the office. So we're covering services such as preventive visits for adult and children over age 2, and then even physical occupational speech therapy, mental health counseling, intensive outpatient therapy. There's a wide array of services that we're covering where you can actually just do it via a video chat or a phone call. And those will process the same way as if you were in the office. And like I was saying, we have seen a huge uptick in this, so I know a lot of you have actually utilized this benefit, which is great because you're still getting the services that you need without having to go into the office. Quickly, I won't read through all of these, but as I had mentioned, Amwell is our urgent care telemedicine vendor, and it really was put in place just so that you as a member didn't have to go into urgent care or the ER if you had a rash or an earache or a sore throat, something that was somewhat urgent, but you didn't feel like you actually had to go in and see someone right away. So Amwell, you can call, you can be either put in a queue, you can wait for a doctor, you can video chat with them. So it's just another avenue to get that care that you need either at home or if you're traveling. And then again, the local telemedicine services that we're now offering due to COVID are on the right. And I touched base on some of those in the previous slide, but here's an additional list as well. Switching gears to some of our resources, and this one I'm highlighting just because we relaunched it on September 1st of this year. So we previously had a cost transparency and comparison tool, but it wasn't very user savvy. So we realized that and revamped the whole thing. So it's really a tool to help you research the cost and quality for providers and services. And the nice thing about this tool is that since it's through the Member Resource Center, it'll actually display your current benefit information. So if you have a copay for the service, it'll show you the exact copay you're going to have to pay. Or if you have a deductible and out of pocket on that total choice plan, then it would show you that information and how much you've met towards those totals and how much you would expect to pay. So I just put a print screen here. When you log into the Member Resource Center, right on the front page, if any of you have been out there, you've probably seen this. The estimate cost link right there will actually bring you right to the tool. If you click on that link, you have to accept a couple of terms and conditions, and then you pop up. What will pop up is this search box, and it's actually bigger than this. I just had to minimize it for the slide. But you can search in here. You can search by procedure. You can start typing a procedure, and a bunch will kind of auto-populate down below that you can choose from. You can enter a procedure code if you have that from the doctor, or you can enter the doctor that you're looking for. The one thing to note is you'll notice my location when I did this was Barre, Vermont, but you can change that location, and then you can find providers and costs based on a radius. And then, like I said, it does have a chart, which I don't have here, but it does display your certain out-of-pockets and what your copay might be. Some additional tools and resources. I'm sure probably most of you have been out to our website, but just the BCBSVT.com. Some things you can do without logging into the Member Resource Center. You can look at, for Find a Doctor, you can find providers that are in Vermont, or actually you can even link out to the national website from there as well. We do have a COVID update center, although I'm sure being state employees, you have access to great tools as well, but we have our own out there. You can also look to see what kind, we haven't done a ton this year just because of the pandemic, but all of the Apple Days and the Hike, Bike, and Paddle, all the calendar events and the different things that we sponsor are also out there. And then the Member Resource Center, I did touch base previously just quickly on this, but I wanted to let you know that also out there on the Member Resource Center, not only is that where you can do that cost transparency tool, but also view your claims, view all of your summary of health plan payments, which are those papers that you get in the mail once a month that explain how the claim processed. You can actually go back in and see copies of those. You can print some, you can print historical copies for the year. So you can look at all of the claims details out there as well. And then instead of calling customer service, you can actually send them a secure message through the Member Resource Center as well. I'm going to flip it over to Colleen, who I mentioned is joining us from our integrated health department as a nurse case manager, to go over our integrated health programs quickly. These might be a reminder for some of you, but they're very, very important, and we have local case managers working with our members. So I'll let Colleen kind of go through the list here.
Thanks, Jess. Hello, everyone. So our most popular program is actually that first one, Better Beginnings, for our pregnant members, that they have a nurse that they can talk to. It's considered a wellness program, and the nurse will check in, see how things are going, make sure everything's going along as well. There's also an opportunity for through an app to chat with the nurse, so that you don't necessarily have to be on the phone. You can do a chat feature, which is nice, and a lot of our pregnant members enjoy using that tool. There's some perks like a car seat voucher, or some fitness classes, or some homemaker services after the baby's born. So there's a lot of perks that come with it. In order to utilize the full benefit, it's best to enroll by at least 34 weeks of pregnancy. And so that's one of our very, very well used programs. Care coordination happens whether you may know it or you may not know it. So this kind of, our utilization management nurses that do prior approvals will work with facilities if you're in the hospital and you need to go home with a wheelchair or some home health services, helping to coordinate all that and make sure that everything that you need to successfully transition to home happens for you. You also will probably receive a call from our transition of care nurse, and she will work with you for 30 days after you've been in the hospital, also to make sure that you can get follow-up appointments, get your medications that you need, understand your instructions, and just kind of make sure that you're doing well at home. Case management. Case management is for our people that, our members that have really complex issues. They may need a transplant, they may have cancer, they may need care that doesn't happen in Vermont, and coordinating all of those services and benefits. So it's a one-point person for you when you're dealing with a catastrophic event and you're just at a loss, trying to navigate insurance with the healthcare world and who's going to do what, and taking you out of that kind of middle, we say, to let us deal with the insurance. Just call us and let us deal with that. Talk with your providers, work with them on prior approvals or anything that you'll need to kind of help you not stress about that insurance piece. Prevalent condition management is what we now call it chronic condition management. It's for people that have diabetes, asthma, heart disease, heart failure, or COPD. And so it's really self-management and how to take care of those conditions. And so if you're struggling, if you're a diabetic and you're struggling with keeping your blood sugars under control, or you wake up at 3 a.m. and you're really super low and you have to eat something, or you're just having some problems, the nurse will work with you and help you understand when to eat. Maybe you need to eat a bedtime snack. Maybe you need to go to your provider, or if you're not seeing an endocrinologist, you might need to go see an endocrinologist and figure out the ways and how to get that best controlled so you can live your best self with that condition. So you're living with a condition, but you're otherwise healthy. It's really what we want you to be experiencing. Rare condition management, we use what's called the Accordant Health. And the reason we chose Accordant is because we have members that have some of these rare conditions such as multiple sclerosis, ALS, ulcerative colitis, Crohn's disease. And you might say, well, that's not really all that rare. Well, what makes it rare is that people that have those conditions can get the support from nurses and doctors that kind of work in a pod to really understand that illness. What is going on in the world of ulcerative colitis? What is going on with multiple sclerosis? What's the latest and the greatest? Where are the resources? And really helping you understand that illness. And we just don't have that kind of level of support to provide to members. So we thought it was important to really have expertise that you could work with. And you can work with them directly on the phone, or you can work with them on your own through their website. They have an excellent website with lots of resources and ways to connect with your case manager at Accordant Care. And if you have on the phone, I know Clark mentioned not mentioning anything personal, but if you do have anything personally that you'd like to get some help about, feel free to let me know. I'm happy to provide my number. You're welcome to call me. I can get you connected into any of these programs if you think that they would be beneficial to you, or if you just have a question that you're not comfortable to ask in the chat, I'm happy to be available to you.
Thank you, Colleen.
You're welcome.
We'll switch back. I think that pretty much finishes up the slide deck. I know we wanted to save room for questions, so I've just put on this last slide here just so you're familiar with how to get a hold of customer service for those kind of private questions. You can call the phone number listed. You can email them back, not a secure email, so if you want to send them a secure message, again, do it through the Member Resource Center. But also you can visit our website as well. And I think at this point, Clark, if we want to open up for questions and save the rest of the time for that, we certainly can. And then I can follow up after with the phone numbers for Colleen as well.
That sounds great. There's been a couple people have sent me questions directly regarding if this slide deck will be available. And what I wanted to let everyone know is that I am hoping to send out a large email or update the website at some point to have all of the slide decks that were presented, as well as the recordings of the videos or the recordings of the presentations at the end of the benefits fair. So if it's been a lot to sort of keep track of, I understand it's a lot of information. So they will be available at the end of the benefits fair. Otherwise, there hasn't been any question. Oh, I'm sorry. Actually, one just came through. Look at that. So a question here, using the MRC tool, does it show cost to the individual or a cost to the plan or both?
That is a good question. And I believe it only shows the cost to the member, but I will double check on that and get back to you. Beth, I see that there. I'll double check. I think it just shows the member amounts and the member owed amount, but I'll definitely double check on that.
I think
Okay.
it shows the cost, and the other really cool feature too is you can compare. So if you wanted to compare the cost of a mammogram, that's diagnostic mammogram, between Central Vermont Medical Center and University of Vermont Medical Center, it'll allow you to do that, so that you also can see what the difference is of cost. So if you're concerned in how much the plan is paying and you want to make sure you're using some place that's less expensive, that it'll allow you to do that.
Thanks, Colleen.
You're welcome.
And actually, along those lines, here's another question about the tool. You know, I know that when you sign into the tool and you look for services, it will show you your direct cost in terms of our coverage. Do you know if it shows cost per providers, or if it shows providers that don't accept insurance? So perhaps either out of network, or the type of provider you would go to and then file a claim to Blue Cross for reimbursement.
It will just show the providers that we contract with, because we've used the pricing that we have in the contracts with the providers. So if the private provider is not participating, it wouldn't show up there.
Okay, so for anyone else, the members would be, you would suggest that the members get in touch with the providers themselves for a cost estimate?
Absolutely. Yep.
Yeah, that's a great point. And Clark, it would be, also to everyone, if you are considering going to see a provider that does not accept insurance, please call us so that we can help you with that, because there are a few things that you may need to submit for reimbursement, or the provider may submit the claim for you. There's just different nuances when a provider is not in network with an insurance, and we want to make sure you understand that before you utilize those services.
Thank you. There was another question here, and actually, looks like someone else in the chat answered, but the answer they gave is actually not necessarily completely accurate. So for dependent children turning 26 in 2021, they're asking if they're eligible to stay on the plan until their actual birthday.
So they can stay on until their actual birthday. I actually see that reply, and I'm wondering if someone's on a qualified health plan. I think that's the qualifications for a qualified health plan. But you can stay on until you actually turn 26 and then come onto the plan.
Right. The exception that was put into place for this year, in which they were covered through it the entire year. This was an exception put in place for the pandemic. Starting again in 2021, it will revert to the way it was, in which the coverage will terminate in the month in which they turn 26. All right. Any other questions?
Yes, we will have the copy. Oh, go ahead, Clark.
Yes, I'm sorry. Yes, there will be a copy of presentation made available to everyone. And it looks like there's another question coming in. Can you explain the process for members to connect to Amwell?
Oh, yeah, sure. So it's actually just an app on your phone, and Clark, I can send you the materials on how to download the app, and it's a simple process. I would recommend downloading the app, whenever, and then when you need it, you'll have it. You do have to put in your ID number so that they can verify your benefit information, but it's very simple. And then when you go to need the app and use the services, you just log into the app. You can select what kind of provider you want to see, or what what symptoms you're experiencing are, and then you can choose to either wait in a queue if there's a queue, or you can have them call you back when a doctor is available. So it's super simple, but I will send the information over to you, Clark, so that they have the kind of the step-by-step.
Yeah, I just wanted to piggyback on that too, Jess. So when you do register in the app, it'll ask for your payment information, so that if there is a cost share, I mean, we know rate to share, even though there is no cost share, they'll still want that information, kind of similar to when you're getting DME. They may want that credit card or some sort of payment information in case you need to be charged. You will not be charged before the visit, and you will not be charged until after the claim is processed.
Okay. Any other questions? And yes, I believe the question was, will we have Colleen's phone number if they wanted to contact you regarding the chronic management? And I believe just said that you'd supply that at the end of the presentation.
Yep, I'll absolutely get that information.
Yeah, I can give it to you if anybody wants to write it down. I'm happy to provide it. My direct number is 371-3409. It's a confidential voicemail, and you're welcome to leave as much detail or as little detail as you want.
And here's another question. Actually, this is an interesting question. As many of you are aware, we offer two plans: Total Choice and Select Care, which is a PPO and a POS. Not to get into the acronyms, it's just those are the two plans that we offer. If we were to use the cost transparency tool, is there a way to see if there would be, so if someone was on Select Care, would they be able to see what the cost would be if they were under Total Choice? That would be very handy in terms of open enrollment.
That is a very good question. And unfortunately, that is not an option because it reads what benefits you're currently on when you log into the Member Resource Center. So you can't compare it with the tool. What I would suggest, though, if you're wondering, is that you could call customer service just to review the two different plans. Generally, anything that would take a copay if you're on the Select Care would go towards that deductible and out of pocket on the Total Choice. So it doesn't compare them on the tool. But if you have questions about what it might cost, certainly customer service can help with the dollar amount.
Great, thank you. And someone is asking if there's a phone number to call in if they're having trouble logging into the Member Resource Center.
Yes, the Member Resource Center, if you need like a password reset or you're having issues, is actually through Health Trio, and I don't have the number in front of me, and since I'm sharing my screen, I can't navigate to it, but I will send that, or if you're out on the website, there should be a Health Trio number right when you're logging into the Member Resource Center. I think it says if you're having problems, you can call Health Trio. You can call Blue Cross first just to make sure you're entering the information correctly if you're having trouble signing up. But if you've already signed up and you've just forgotten a password, Health Trio would be able to reset that.
Can you just repeat that part?
Sure. So if you have, for the Member Resource Center, if you've forgotten your password or you need to reset it or you're having trouble logging in, you would want to call Health Trio, and I will get that information over to Clark. I believe it is out before you log into the Member Resource Center, but out right there. You can call our customer service team, but because the portal is managed by Health Trio, they can reset the passwords and everything. If you've never logged into the Member Resource Center and you're having trouble with that, then make sure you have your ID card, and our customer service team can actually walk you through the process of signing up. But if you have a sign up, Health Trio would be able to help with the password.
Again, is that Help Trio, T-R-I-O?
Oh, Health, H-E-A-L-T-H.
Health Trio.
Yep, and then T-R-I-O, yes.
Okay, great. Thank you.
And then someone posted a phone number in the chat if that's accurate.
I'll double check on the number. I don't have it right in front of me, and I'll verify with you.
But thank you, Patricia, for posting that. That's helpful.
Definitely.
All right. Any other questions?
I do have a question. Can you hear me?
Yes.
Yeah.
when it comes to the Telemed, do you guys have a plan or, a plan where people are, they're available to get that anytime, day or night if they're sick, or is that just specific?
So no, Amwell, the Amwell part is 24/7. So that's
Okay.
the what kind of the urgent care one. The other telemedicine visits, there's no specific time, although I would imagine generally they're within office hours of a provider. But no, we don't have a specific time. I mean, if the provider is willing to see you and they bill the claim to us, then it would process just like any other claim.
Okay, so there's nothing, so you're saying Amwell is available 24/7? Like in the middle of the night
That's
to call if you're worried about something? They are.
That's correct, yep.
Okay, and is there a number for them?
Yes, I will send the information to Clark over. The best thing to do is download the app, but it will also include the phone number that you can reach them at. And we have materials on it, so I'll send that out.
Oh, great.
Yeah.
Oh, great. Thank you so much. Okay.
Sure.
I just want to add to that too. So if you're due a face-to-face, if you can see the provider can see you, then they can prescribe for you. But you can do just a phone call, but the provider cannot prescribe for you if it's just a phone call. So I just want to make sure you know there's two differences.
Great. Thank you for saying that.
You're welcome.
Good to know.
All right. Any other questions?
I just have one quick one. Unfortunately, I at a meeting, so I just got off that meeting, so I missed the first half hour. Do you have this that you could send me that I could listen to, or whatever, you know, or your PowerPoints or whatever?
Yes, we are recording this session. In addition, we will be providing at the end of the week, at the end of all the benefit fairs, I will be putting everything together, the slide decks, in addition to the links to the recorded videos, so that it'll be all in one place that people can look over the slide decks as they're at their leisure, if you will, and also look over the recorded sessions.
Okay, and you'll send us, you know, that sounds great, because I'm so sorry I missed it. The call went longer than I realized. Thanks so much. I'll look for those and listen to the recording and
Okay, great.
the slide deck, but the recording will probably be more helpful. Thank you.
There's a question in the chat about the premium change. That is currently, we have made our recommendation to the unions at this point, and it's under review there. You should have that information very shortly. Any other questions? There are no planned benefit changes or copay changes. From going from 2020 to 2021, there will be no, ostensibly, there'll be no changes. There was a question about whether copay amounts were going to be changing year over year. Okay, there's no other questions coming in, so I wanted to thank Jess and Colleen for taking some time and chatting with us here at the state, and thank everyone also for attending today. again, this is a new format for us, so we're seeing how this goes. And I think today went pretty well, and hopefully the rest of the week is also informative and can get some of your questions answered as well. So Jess, do you have any, or Colleen, any closing statements?
I just wanted to say thank you, and all of the follow-up information, Clark, I will send to you directly, and you can disperse out.
All right.
Yeah, thank you. Yeah, and I just want to say, if you ever have any questions, please never hesitate to contact us. We're happy to help you.
All right, excellent. Well, thank you again, and thank you to everyone for attending. And maybe we'll see you tomorrow for tomorrow's scheduled presenter is Express Scripts, which is the pharmaceutical benefit. So thank you again.
Thank you, everyone. I hope you have a great day.
Thanks.